In order to have a good health ending is to have rapport with your doctor, your nurse, your next practitioner, whoever it is that you're speaking to. And that rapport comes out of something. You have to connect in some way. So there has to be conversation. I think the thing that we do in the health field that's really kind of tricky is a person comes in and they go, fill out this form. Okay. Yeah. So the first thing is, can they fill out the form? Mm-hmm. Do they know how to read? Do they know how to read English? Okay, yeah. Because we don't have a lot of forms that usually have other languages. And so at that first point, that first juncture, you have somebody that goes, oops, don't know how to read. I'm not going to tell anybody I don't know how to read. And so therefore, what's going to happen is I'm going to look stupid, and so I'm going to not do it at all. The health care provider has to try to connect with this person. So to me, you have to first start asking them what brings them there. What's their story about being here? Well, how'd they get here? You know, did somebody send them? Did they come of their own volition? Those kinds of things.
Well, and it really fits into the health literacy, as we've talked about. The health literacy is really the interactions between the health systems, between the health providers, professionals, and consumers or patients. And really, if you cannot have that rapport or have that connection, it's going to be really hard to have a meaningful interaction.
Right. So under rapport, what they talk about is connecting. They talk about engagement, and they talk about an avoidance, to be aware of our own judgments, which is a real biggie. Because a lot of us don't want to say that we're judgmental toward people, but we actually are, you know, because all of us run around with judgments. Nobody runs around with not being judgmental. But we can keep them at bay if we know that they're there and they may come out in our interaction with other people. And then the final other thing on a rapport is the whole respect model in itself.
Right.
So it's really important that we kind of figure out, okay, so how do we do this first one, rapport? How do I enter into something? My way of entering in with somebody is to have them really tell me their story, like I said before, in all detail that they want. And sometimes, you know, people get concerned about, well, how am I supposed to be writing that down as I'm doing that? Well, you're not going to be able to. You're going to have to be able to take notes and then go back to that at another time.
Yeah, and being able to see from the other person's point of view.
Right.
And I think it's really important that we think about that it's not just that the patient can have a rapport with the doctor or the provider, but really that the provider is also able to establish a rapport and see that other side of it. Because a lot of times there's a fear of our providers.
Right.
And being able to see where they're coming from and being able to connect with them will really improve those health outcomes.
Absolutely. So the next one under the model is empathy. And all of us have a particular way in which we define empathy. But most of all, it means that you are willing to, as the old saying goes, walk a mile in the person's shoes, okay? To be able to know totally what that life must be like, the feelings, the context, everything. That's hard to do, particularly if you've never lived that life, right?
Right.
And none of us, you know, even in the same family, live the same life, right? So in other words, we're always going to be looking for, okay, how did you do it? What do you feel about it? But empathy also means that I'm willing to listen to you. Mm-hmm. I'm willing to listen to what you have to say, and that whatever you say about your own self has just as much value as what I'm saying. And that's really important. Empathy is not sympathy, as we know.
Right.
You know, and so it's not about feeling bad and going, I'm really sorry that really happened to you. I don't know what else to do or what else to say. But empathy to me means I'm walking in the journey with the person. I'm just walking with them and trying to figure out what's the best thing for us to do to get them to a place that they feel more whole.
And I think for me, empathy, when we look at health literacy, and why this really spoke to me, is being able to see where the person is coming from. When you discuss with somebody a health plan and you lay out something that's really, you know, for their best, that they need to do an exercise program, that this is a new diet that they need to do, being able to have empathy to know where they're really coming from, like, do you even have a working stove at home?
Exactly.
Do you know how to cook?
Right.
Do you have the funds to be able to make that? And a lot of times we just look at the people that we work with and say, oh, they're not compliant.
Absolutely.
And it's not that they don't have a desire to be compliant or, you know, or to be healthier. It's they might not have the ability at that time. So if you can be empathetic
Exactly.
and see where the person is coming from, you might actually be able to really help set up a good health plan that will work for them.
Absolutely. And to me, you have to have empathy and rapport in order to get to support. In order to actually provide people support that is meaningful in their lives, then you have to have those two ingredients before that happens. So like you were talking about, maybe not having a stove or having the things inside their own house that they need. So you have to find out, where are they at? Is this person homeless? Does this person have Section 8? Is this person bound by a particular income because they're older? Whatever it is. So you have to figure out, okay, what support is available? And then the biggest thing that we have a problem with is finding out the support that's within that community.
Right.
Because a lot of people have a hard time moving outside of their community in order to get services. I think that's where we lose them as well. So when we have something in the community that provides support, whether that be bus tokens, whether that be we can get you another stove, whether that be I can find you some housing temporarily, the more they can be within that community, the better off we are. But we are the people that folks lean on at first.
Right.
I don't understand why people go into human services and don't realize that we're the ones they lean on. I mean, people lean on us until they're strong enough to do it themselves.
Right. Most definitely.
Yeah.
And I would say that I think this is where the social determinants of health come in.
Right.
If we're talking about having the empathy to be able to then move to see what supports people need. But we talk about the social determinants of health being transportation, housing, health and health literacy, economic status, and then your education level. Those are all things that can really play into what's going on and what support somebody needs.
Absolutely. I think at this point when we're providing them the rapport, empathy, and then the support is then we can actually start becoming a partner with them. I see this as all trying to gain trust for us to gain their trust for us.
Right.
So that also means that we have to, as a partner, you have to, if you're going to say something, then you got to do it. You got to follow through with it.
Right.
You can't keep leaving people hanging, and you have to go the distance with folks.
Right.
If you're in a partnership, I'm going to go the distance with you. You don't worry, I've got your back. Like you would do with any partnership, whether it be a business partnership, a relationship, a personal relationship, a partnership with your friend, with your parents, whatever. But with the folks that we work with, that partnership is really important because most of them, at least in my experience, it is that they don't know what a partnership really is. So by then, hopefully, they've gained enough trust in you that they can actually go, okay, maybe I can count on this person for a little bit of time,
Yeah, and I think that also when we're taking a look at setting up a treatment plan for somebody, we're hearing all these new programs of patient-centered, shared decision-making.
Right.
Do you know what I mean?
Yeah.
And when we look at those different ways that we actually want to treat the people that we work with, we want to have them as our partners. Do you know what I mean? And so to be able to do that means establishing that partnership.
Absolutely.
And I think this model does a great way of being able to lay that out of if we're going to talk, for me anyways, if we're going to talk about setting a goal, if you include me in making the steps of how and the timeline and those type of things, I'm much more likely that I'm going to follow through.
Right.
Because I feel a part. I'm a partner with you.
Absolutely.
You didn't just tell me what to do, and you didn't understand where I was coming from.
Exactly.
And I own it.
Right. And in order to do that, when we're developing a relationship at first, the development of a relationship is about, okay, what does this mean to you? What does this mean to you? And explaining ourselves to each other. Explanation is another part of this model. So if I say, I believe respect, the word respect is this. I tell you how it looks to me. That may be different from how it looks to you.
Yeah.
But let's say I come in and I have a physical ailment that I don't understand. That I have there's some pain in my knee. I don't know what it is. It's never been there before. And then somebody takes x-rays and all those things and they come back. Well, sometimes they just show you the x-ray like you actually know what you're looking at. Okay. Yeah. But the other thing is that what they do is they then start talking about what's in your knee.
Right.
Well, unless they are all the things we've talked about before, and sensitive to the fact that you may know, first of all, you're scared because there's
Right.
something wrong with your body. But the next thing is that now you don't understand the words they're saying,
Right.
and you don't know whether you can ask them the question. You know?
Right.
So that's really a difficult piece. So explanations that they talk about in
Right.
this model are really important, really important.
And that's also where this model really hit me or spoke to me again with the health literacy part, because it talks about the confirming understanding.
Exactly.
And it talks about making sure that you're clearly articulating
right.
in the language
That's right.
that is best for the person that you're working with.
Exactly.
And a lot of times that takes assessing that and being okay to ask for the confirmation of understanding.
Right.
So, yes, the explanation part is really important.
Absolutely. And then, of course, the cultural competency piece that you talk about in terms of the C. All of us can't grow up everywhere, right?
Right.
I was an Army brat, so of course I mostly lived outside the United States. So when I came back to the United States, that was the culture I didn't understand.
Right.
I understood all the other cultures I was in, but I did not understand the United States at all because it had changed from the time that I left to the time I returned greatly. And so what I had to do is go, okay, I'm not even competent in my own country. I don't know what I'm doing. You know, didn't know what the questions to ask. I didn't know why people are acting the way they did. It was different. And then that's when I realized I had a different culture, which was a military culture.
Right.
You know, that my culture was very different. You know, I'm black, but the fact is I lived in the military. Much different experience from the people I came back to that lived in the inner city of a big city. I mean, inner city. I didn't know what that was about. So what I'm saying here is that what's really important is that the biggest thing that we have to remember about culture is we have to ask the question. We all like to talk about ourselves. You know that, right? Somebody says, oh, who are you? Oh, yeah. So they start talking, you know. I went here, I went there, da-da-da. But the fact is that what you want to do is you want to ask them questions about so that you can get to know them a little bit, what their beliefs are. What are their traditions? What do they believe about sickness? What do they believe about health?
Right.
How do they operate when they are sick? Who do they go to? You know, those kinds of questions are really very important.
But I think it's really important, too, to broaden our scope when we think of cultural competence, because you can have two people who look exactly alike and maybe have the same demographic, but their family values around healthcare are completely different. There are some folks that, you know, they go every 6 months for preventative. They've had the health care. That's a part of their upbringing. And then you have others who, unless you were bleeding and needed stitches, you weren't going to the doctor.
That's right.
You know what I mean? And so it's just not in their, it's not a part of them. And so being able to recognize that somebody may not be trying to be difficult.
Right.
They just think that they're not actually allowed or should be asking for preventative health care. It seems like a luxury.
Absolutely. And then the final one of the respect model is T, which is trust. And to me, the whole trust thing is first, for me, is trusting my own competence. My own competence in doing what I'm doing. To feel good enough about the knowledge I do have, doesn't have to be all of the knowledge, but the knowledge I do have, I can actually engage this person in a conversation and in a relationship with me. It means that I trust the person to know what they know about themselves, and I'm not going to deny them that. You know, I'm not going to say, well, you shouldn't feel that way. You know how people say that all the time? You shouldn't feel that way. And I'm like, well, no, they can feel that way if they want, so that we can have an actual conversation. Trust is really important, as well as trust in the process of the partnership, because it goes through levels of understanding.
Right.
It goes through levels of intensity, and we have to move and change with that, but feel okay about doing that.
Most definitely, and I think it's really hard to think that unless you do the other parts of this model, that somebody's going to have the trust for you.
Exactly.
Because without having somebody showing you support and establishing the rapport and having some empathy, it's really difficult then to sit across from someone and think, you know, they've got your best interest at hand. The other thing is we're so vulnerable.
Absolutely.
When we're in the health office, if you think about it. Whether we're doing disease prevention or you're seeing the doctor or whatever, there's a little bit of whether you're in the hospital gown,
Right,
sitting on
exactly.
the table,
Which is
or
not
you're
a
getting,
comfortable feeling.
yeah, kind of a thing. And so that trust is so important, I think. And I loved how you said that about first you have to trust yourself in order to be able to get that trust level with your patient.
Good morning, Miss Anderson. It's good to see you again.
Hello.
The last time you were here, you just learned you were pregnant. How was the rest of your pregnancy?
Not so good. I started getting headaches, and then felt nauseous, and then I was told that I had high blood pressure. And then my son came early after 6 months, and then he had to stay in the hospital for 12 weeks after that.
How's your son now?
Oh, he's okay now. I have a therapist that comes to the house to help me take care of him once a week.
That's good to hear. I'm glad you have some support. I'm sure this has been a difficult experience. Now, what can I do for you today?
Well, my OBGYN says that my blood pressure is still too high and that I should see my primary care doctor on advice on how to get it down. I think I probably had high blood pressure before I got pregnant and didn't know about it. I think that's why my son was born early.
Well, your high blood pressure certainly could have been a reason for your son's premature birth. High blood pressure or hypertension negatively affects pregnancy, both for the mother and the growing baby if it's not treated.
Yeah, and now I'm starting to feel the same way I felt when I was pregnant and getting headaches and having to sit down all the time because I was dizzy.
It's good you came to see me today. Let's start by checking your blood pressure, and then we can discuss your options for keeping it under control. The first thing we need to talk about is how to keep your blood pressure under control.
Well, there's a lot of people in my family that have high blood pressure, and there's a group at my church, but I'm too young.
Too young?
It's not something I need to worry about at my age.
High blood pressure can strike a person at any age, and it's very common for African Americans like yourself. Blood pressure is a measure of how the heart contracts. Diseases like kidney failure, congestive heart failure, and strokes all begin with high blood pressure. And as you know, high blood pressure may affect your children as well. That's why keeping it under control is really important.
Okay, but I don't have money for medications and stuff like that.
That's okay. I encourage you to check out the group at your church. And I know that Applewood Clinic around the corner offers a low-cost program too. I can get you additional information about those programs if you're interested.
Yeah, I'll check it out.
That's good to hear. I think you will really benefit from those programs because they will inform you about healthy living choices aimed at controlling your blood pressure. Now, I want to go back to what we were talking about before with your pregnancy and labor experience. Are you planning on having more children in the future?
I know I need to take care of myself and my son, but I think I might be pregnant again.
Do you use contraceptives?
I'm not on the pill. My doctor said the pill was a bad idea for someone with high blood pressure.
That is true. How about condoms? Do you use them?
No, my boyfriend doesn't like to use them.
Thanks for sharing this with me. It's important I get a complete picture. Let's start by having you take a pregnancy test, and once we figure out if you're pregnant, we can discuss some options for safe blood pressure control throughout your pregnancy. We can also discuss ways to prevent unplanned pregnancy in the future that won't affect your blood pressure. Are you interested in learning about these treatment options?
Yes, thank you.
So the last part of the model is trust, and that's what we saw in this video. Mm-hmm. Here is an African American woman coming in, high blood pressure, doesn't really understand what that means, maybe pregnant. The doctor took her through rapport, empathy. It was just beautiful.
It was.
It was absolutely gorgeous. But what I really picked up on that in terms of trust is that she trusted her own competence. The doctor trusted her competence. She trusted the competence of the woman to be able to say to her, these are the things that are going on for me. I don't understand that. I don't want to do that, whatever. But trust was really there. But I was amazed how she just walked through the whole model. Rapport, empathy, support, partnership, building a partnership, those kinds of things. Giving her explanations. This is what high blood pressure means.
Yes.
This is what it means when you're pregnant and you have high blood pressure. These are the kinds of things we can do for you. The cultural competence piece was just exuding out of there, you know. But trusting herself, trusting in the process, and trusting in the process between her and the woman to build that partnership was just beautiful. It was absolutely beautiful.
It was, and it really embraced a lot of the techniques of health literacy about chunking it down. And she took the different issues that she was facing. Let's like first talk about the high blood pressure.
Right.
Now let's talk about family planning, instead of trying to address it all at once.
Exactly.
And so it was really nice to see that scenario. One thing that she probably would have done if they had continued with that is just confirm understanding.
Right.
Because she went through a lot of that information with the patient in a really nice way. But sometimes our folks can just want to be pleasing, or they don't want to let us know that they don't know what we said, so they can shake their head and say yes. So, but it was a really nice video of what how you can make someone feel safe,
right,
and not judged.
Absolutely.
When you're trying to gather some rather private information from them.
Absolutely, yeah. And you could see it in the black woman's face. You could see that she was like relieved. First she was fearful, then she got a little bit more at ease, then she became relieved by the end that, okay, she's in good hands with this particular person.
Right. So in health literacy, one of the strategies that we think is most effective is implementing universal precaution measures. And that means assuming that everybody might have a challenge in understanding what you're telling them. So regardless of somebody's reading comprehension or their auditory or their language barriers, we can actually implement strategies or tools that can help you be successful with your patients or clients. And a few of those strategies, the universal precaution, the RESPECT model fits that. That is one tool that we could actually use. When you implement that with everybody, you're going to improve the outcomes.
Right.
The other is clear communication. And that's where we start in plain language, where you start to avoid using jargon and your esoteric medical language. Instead of saying you have hypertension, we're going to talk about high blood pressure. As well as then we talked about confirming understanding, so that when you leave, that you know what I've asked you, what the health professional has asked you. An example of that, why you need to have confirmation of understanding, is there's a case study of a man who went in for a pre-exam for employment. He had to have an exam, and he found out that he had high blood pressure. So they put him on a beta blocker and high blood pressure medication and sent him on his way and said, you'll be fine. Take these 2 pills once a day. And so a week later, he comes back to the emergency room with low blood pressure. He's very dizzy. And after numerous tests and numerous teams trying to figure out what was going on with him, somebody who actually spoke Spanish asked him, how many pills are you taking in a day? And he responded, 22.
Okay.
Because in Spanish,
22. Okay.
once spelled out is also once, which is the number 11.
Okay.
So twice a day he was taking 11 pills. So it's just really important to have clarification.
That's beautiful. And I just want to put one more thing in that I think is
please.
really important for the RESPECT model, and that is it does insist on collaboration. If we're not going to collaborate with each other, we cannot enact this model, because we need each other in order to really complete it.
Correct. And I think the other thing that's important to realize is that health literacy is the how to accomplish your goals, whether it's patient-centered, whether it's value-based payments, or shared decision-making. This is really the how of how we can accomplish that.
Right.
So,
we've just reviewed the RESPECT model.
Right.
We have to remember the pieces of the RESPECT model: rapport, empathy, support, partnership, explanations, cultural competence, and trust. All of these things take us to be aware of who we are and what we're doing and how we're speaking or not speaking to someone that is in our care. The piece of the RESPECT model that really works is if we really follow it in terms of what it would feel like, not just to us, but also to the person that we're talking with or we're dealing with in a clinical setting.
And now we want to hear what you're doing with the RESPECT model.
Please post your stories using
#, find out what it means to me. It would mean a lot to us.
Yes, it would.